Clinically, the patient will complain of chronic secretions of cloudy fluid, blood, pus or stools, according to the severity of the fistula disease. Often there is a prior medical history of abscess, chronic recurrence of the abscess accompanied by signs of severe infection such as fever, pain, redness and swelling. Causes and risk factors of anal fistula. The most common cause of fistula formation is the emergence of an abscess in the area around the anus, where the abscess drains through an external port through the skin and forms a hole in its internal port that drains into the anal canal. Other reasons for this phenomenon are complications arising from childbirth, infection, complications after surgery for hemorrhoids or anal fissure. Patients with inflammatory bowel disease, such as Crohn's disease, diabetes, ulcerative colitis, are more vulnerable to this phenomenon. Additional reasons include hidradenitis TB, tuberculosis, actinomycosis infection, malignant tumors and complications due to local radiotherapy. Certain diseases, such as AIDS and diabetes, can increase the risk of this phenomenon. Diagnosis of anal fistula. Diagnosis depends in most cases on clinical symptoms, although there are cases that require diagnostic procedures such as MRI, CT, fistulography and transrectal ultrasound. Treating anus fistula. Treatment depends on the type of fistula and whether the external sphincter muscle is also affected. In most cases, opening and removing the fistula duct by performing an operation, a fistulotomy, is an adequate treatment. Fistula, which leads to injury and a large part of the sphincter, and muscle puberectalis, musculus puberectalis, may lead to complications including fecal incontinence, if treated in the manner described above, so it is better to address such cases more conservative. There are many treatment methods. Among them is the treatment of a fistula named after Seton, which is a surgical treatment in which a wire is inserted through the fistula's duct to drain and close the fistula. Other treatments include closing the internal passage of the fistula with a sling. Recently, the adhesive fibrin glue, has been used, which in some cases succeeds in closing the fistula.